It's crazy when you think about all the different kinds of foods we eat. We just swallow and hope it all works out for the best. Well, as it turns out, there are better ways to think about keeping our bodies humming healthfully along. Welcome to the Nutrition Facts podcast. I'm your host, Dr. Michael Greger. If you look inside your mouth and you find lacy white patches, sometimes with redness or sores on the inside of the cheeks, tongue, or gums, you may have the inflammatory condition oral lichen planus. Here is one way to treat it. There's an inflammatory autoimmune condition known as oral lichen planus, in which our immune system starts attacking the lining of our mouth. It's actually not that rare. It strikes up to 5% of the population, particularly women, and about 1% of cases can turn into cancer. And there's no cure, there's just symptomatic treatments, steroids, immunosuppressants, and total glucosides of peony? Like peony? Yes, medicinal properties in the root of the common garden peony. That's neat. But are there any edible plants that may help? There's a plant called purslane, one of the most common weeds in the world. You can see it growing out of the cracks in the sidewalk everywhere you look once you start looking. Its healing properties were thought to be so reliable that Roman savant Pliny the Elder advised wearing the plant as an amulet to expel all evil. I don't know about that. What about just eating it? A randomized, double-blind, placebo-controlled trial found that 83% of those in the purslane group experienced partial or complete clinical improvement, compared to 83% of the placebo group who either didn't respond or got worse. So this simple weed appears to be clinically effective in the treatment of oral lichen planus, with no side effects. In a comparison to the efficacy and safety of 9 different treatments, including steroids and immunosuppressants, purslane appeared to not only be the safest, but the most effective treatment available, with only good side effects, lowering triglycerides and decreasing inflammation. You can overdo it, though. Purslane is a high oxalate green with nearly half as much oxalates as spinach, so even if you don't tend to get kidney stones, you don't want to eat 4 pounds of purslane at a time. I know it's delicious, but as little as 1.5 pounds at a time, or even 2 pounds spread out over 2 meals, could potentially overload the kidney and cause damage. Purslane can even fight lichen planus topically. A purslane gel appeared to work as well as topical steroids, the gold standard treatment. The researchers concluded that purslane is a magical herb, beneficial, lacking side effects, and therefore can be a safer alternative drug in oral lichen planus treatment. But by alternative drug, they're just talking about a weed that grows for free all over. In our next story, we look at additional ways to treat lichen planus. Lichen planus is a chronic autoimmune disease, typically of our moist membrane, such as the inside of our mouth, but can also affect other body surfaces. Current treatments are not curative, but rather palliative, aimed at relieving pain. We've tried steroids, antibiotics, chemotherapy, surgery, and none appear to be particularly effective. So even for palliative pain relief, we don't have great options. So that's why case reports like this are so exciting. After drinking 2 ounces of aloe vera juice a day and applying aloe topically as well. But is ingested oral aloe vera a potion or poison? Internal use of aloe may cause acute hepatitis, liver inflammation, as well as electrolyte imbalances, and you should definitely not inject aloe. But oral use is also not recommended either. This is primarily because of case reports of aloe-induced hepatitis. Aloe is ironically presented as a detoxifying product, but can actually end up causing liver damage. How do we know it was the aloe, though? The assessment of suspected herbal-induced liver injury is challenging, because there's hundreds of things out there that can damage your liver. Here's the kind of checklist you have to go through as a doctor to rule out other causes before you blame it on the plant. Do you have some kind of viral hepatitis or other kind of liver infection, or it could be various drugs or toxins or diseases? So maybe it was one of these other things. It was just a coincidence that the problem started after drinking aloe. The gold standard, in terms of trying to prove cause and effect, is a positive re-exposure test. That's how you diagnose drug-induced liver injury. Liver inflammation disappears when you remove the drug, and then reappears when you add the drug back, which is rarely done for obvious reasons. Well, has there ever been a re-challenge case published for aloe? Yes. Aloe-induced toxic hepatitis that shot up again after stopping and then restarting aloe ingestion. Aloe consumption has also been linked to thyroid dysfunction. A woman with lichen planus started swallowing 2 teaspoons of aloe vera juice a day. She started feeling unjustifiably tired. Lab work showed her thyroid function was low, but she perked right back up after stopping the aloe, and her thyroid function returned to normal. What if instead of swallowing, though, she just swished the aloe around her mouth to try to help the lichen planus, and then spit it out? We didn't know until it was put to the test. A randomized, double-blind, placebo-controlled trial, 54 patients randomized to a topical aloe vera gel or placebo gel for 8 weeks. 81% in the aloe group got better, compared to just 4% in the placebo group. Furthermore, 2 patients treated with aloe had a complete clinical remission. That's rare. It's considered a chronic condition. Yet a few weeks applying aloe, these nasty erosive lesions disappeared. How about compared to a steroid ointment, though? Topical aloe vera gel was superior, more effective than the steroids, a significant difference appearing within 2 weeks. So although corticosteroids are still considered the gold standard, aloe vera shows promising results, especially with no adverse effects when applied topically, compared to various adverse side effects of the corticosteroids. That's for oral lichen planus, though. What about the efficacy of aloe vera gel in the treatment of lichen planus of the genitals? Lichen planus of the vulva is quite common, affecting 1 to 2% of the population, and it may be even harder to treat. There are flares and partial remission, but no tendency for complete remission, and indeed that's what they saw in the placebo group. 1 woman had a good response, but most had little or no response, but applying aloe vera gel instead, and 9 out of 10 responded, and 1 woman had a complete clinical remission. They conclude that aloe vera gel is a safe and effective treatment. Visit NutritionFacts.org/audio to see all the podcast episodes with descriptions that include links to their associated videos. Sources cited and other details are available on each video's page. Information about my books, How Not to Die, How Not to Diet, and How Not to Age, is at NutritionFacts.org/books. And as always, all proceeds I receive from the sales of all my books goes to charity. And sign up for my free newsletter at NutritionFacts.org/subscribe to stay updated on the latest bite-sized videos and articles. NutritionFacts.org is a science-based nonprofit. Everything on the website is free. There are no ads, no corporate sponsorships, no kickbacks, strictly non-commercial, not selling anything. Just put it up as a public service, as a labor of love, as a tribute to my grandmother, whose own life was saved with evidence-based nutrition. Thanks for listening.